So phase 2 of our vaccine rollout is underway. Now people over the age of 60 can get the COVID jab. They simply have to register with a government database and wait their turn. We heard on Monday how the Life Healthcare Group is going to be running 11 vaccination sites and helping to deliver vaccines to many other government-run sites. So if you're a member of a private medical aid, you've likely received communication encouraging you to get vaccinated and registered. Let's speak now to the CEO of Discovery Health, Dr. Ryan Noach. Dr. Noach, thank you so much for joining us. I have to ask you first of all about the problems experienced at your Sandton site today. I understand you had to take walk-ins for the vaccine because there was a glitch with the government computer. Can you tell us more?
Sally, actually it turned out to be a fabulous day, and I'm sitting here in the vaccination site. We've managed to administer almost 1,000 vaccinations here today. There was a glitch on the scheduling. The government system, the EVDS, is actually working exceptionally well and has been scheduling people to come for vaccinations to our sites, and we've been delighted with that. But somehow there was a scheduling glitch overnight, and we landed up with an empty vaccination site when we opened at 8 o'clock this morning, as opposed to a bustling site full of people that have been sent for their vaccines. So we took a quick decision, which we checked in with the Department of Health on, to open up for walk-ins. We did so for elderly people who are eligible for vaccination, and very quickly we filled the site.
Are you going to allow walk-ins tomorrow again?
We prefer not to allow walk-ins. We are going to depend on the EVDS schedules to send the patients to us. And we're assured that all is good for tomorrow, so no walk-ins after today.
Are you inoculating only Discovery Health members, or can public members who are not part of your scheme also come through?
No, absolutely not. We're vaccinating whomever the EVDS system sends us. We've been doing it for 3 days now, and we've had all sorts of people from all walks of life in our vaccine centre. It's been incredibly uplifting. There have been public sector patients, there have been people with medical insurance, both our own clients and other medical scheme patients. And so whomever the EVDS system sends us to vaccinate, we've been vaccinating.
So you said you did 1,000 jabs today. Are you hoping to scale that up even further?
Yes, tomorrow, actually, I'm sitting in the vaccination centre, and if I stand up, maybe you can see the first floor of the building there behind me.
Yes.
I'm currently on the ground floor. Our ground floor has a capacity of 1,200 vaccinations a day when we get going at full steam. And that first floor that you see there in the background, we will duplicate this ground floor infrastructure upstairs. And by tomorrow, that will be open. We'll phase that in. And when it's running at full capacity, we'll be able to do 2,400 a day here.
So that sounds really encouraging. How many other sites are you going to be involved in setting up? I know that there are a number.
Yes, we're intending to open more than 20 sites. We're awaiting accreditation for our further sites. We're ready to open another 2 this week as soon as we have that accreditation. And we'll build up to the full complement of sites by the middle of June. We've tried to match that to what we understand is the available supply of vaccines. And ultimately, together with our partners in the healthcare system, we hope to be able to meet our own target that we've set for ourselves of 40,000 per day.
And that is really significant. How concerned are you at this point about procurement? And I ask that because we're waiting for the go-ahead on the Johnson & Johnson vaccine after the Baltimore factory mix-up. And of course, we've just heard from the Serum Institute of India that they're under severe pressure. They might not be able to supply for months to the COVAX facility. So it's great that you're getting geared up, but how worried are you that you're going to run out of vaccines?
Well, there's adequate supply for the country, and the Department of Health has confirmed that they have signed the contracts and placed the orders. And based on our understanding, that means there's sufficient supply for the country. Of course, our country's procurement is focused on 2 vaccines, the Pfizer vaccine and the Johnson & Johnson vaccine. We're administering Pfizer as I sit here now in this centre, and we're all hoping that the Baltimore factory gets the go-ahead from the Federal Drug Administration. And as a result, the J&J vaccines, which are already manufactured and waiting for distribution, can be released as per the contract to our country.
I have to ask you how the paying issue is working. I've had a lot of questions from people who are with Discovery and other private medical schemes. Do they pay? Does it come out of any of their savings, or does it get billed to them in any way?
No, absolutely not. The short message is that the vaccine is free to all South Africans. In respect of those that have a medical insurance, medical scheme coverage, the medical schemes are obliged to pay as a prescribed minimum benefit. There was legislation passed to this effect, and that means that it's covered in full from risk funds with no contribution, no co-payment from the member whatsoever. And as for the state patients, it is free at the point of care.
All right, I have to ask you, this is a more long-term question. I wonder how much all of this all-hands-on-deck approach to COVID-19 and the vaccination program in particular is teaching you as a private medical scheme about the push for one national health insurance plan. Do you believe that this sharing and pooling of resources is practical, it can be achieved without compromising the service and the cost that you currently offer your private clients?
I think what's very clear to me is that when it's needed, the private and public sector are able to stand together in solidarity to deliver an outstanding service to the country. There is a place for both the public and private sector to be sustainable, to deliver outstanding care, and ultimately our joint ideals must be to lift the standard of care for all South Africans.
All right, so in principle you agree something has to be done. I know one proposal could see Discovery Health, among other private schemes, pooling medical scheme reserves estimated at some 90 billion rand in total. Are you in favour of that plan?
Sally, medical scheme reserves are in fact owned by the members of each of the funds. The funds are trust funds, they're mutuals, which hold the members' money in reserves. Those reserves cannot be touched, they cannot be nationalised, they cannot be taken away from the members. The money belongs to the members. It is the members' money held in trust. So any proposals to nationalise medical scheme reserves are simply not feasible and not legal.
All right. Well, thank you so much for updating us on the work that Discovery Health is doing and playing their role in helping to get South Africa vaccinated. That was the CEO of Discovery Health, Dr. Noach.